everyone. I am Dr. Leena Yadav, Senior Consultant and Unit Head, Fertility and IVF, Miracles Healthcare. So today I am here to discuss with you about a very important topic, and that is the IVF journey. I am often asked these questions from my patients, so I thought let me discuss it with you personally. Let me help you to understand that IVF is not a nightmare. So my patients always ask me, ma'am, is IVF painful? Is IVF costly? Does it involve a lot of medicines? Do we need to take rest after IVF? Does it make us fat? Do we feel that we can't travel outside after doing IVF? So, we all have to understand, first of all, what is IVF all about? Yes, IVF does involve taking a lot of medicines, a lot of hormones, but these medicines are given for the sole purpose of forming eggs, and after the forming of eggs, when we create the embryo, we give you supportive medicines to attain a pregnancy. That is the only purpose of giving these medicines. Yes, there are some medicines which might encounter weight gain, but you have to understand that if you are already a person with a high body mass index, then probably the weight gain would be more. But otherwise, IVF medicines don't cause enough of weight gain. It is just a little bit of weight which is increased, and we can all exercise and manage proper diet and manage our weight. It is as simple as that. The second most commonly asked question is IVF costly? So IVF is costly because it involves hormones, and these hormones are given for the purpose of forming eggs. We have to form multiple eggs in IVF, but again, for every couple, for every patient, the cost of IVF varies. And why does it vary? It varies because the cost entirely depends upon your diagnosis, your body mass index, your age, your parameters of ovary, as to how many medicines you have to take, how many hormones you have to take. So the cost of IVF is entirely independent with different people. You just cannot say that for every couple it involves this particular cost. No. So for some it is less costly, for some it is more costly, and that entirely depends on your diagnosis and your parameters. Is IVF painful? No, IVF is not painful. IVF is painful for those people who scare injections. And believe me, we just give you injections for some 10 to 12 days after the menstrual cycle, and these injections are given for the sole purpose of forming eggs. And I think to embrace parenthood, that much is a little bit which we have to do. Does IVF involve rest? No, IVF does not involve rest. Yes, the medicines which we give you for IVF, they do make you a little bit tired. They give fatigue to some people, and then some people often feel that they should take rest or they feel more sleepy. That's it. But no guidelines, no books, none of the IVF specialists will ever tell you to take rest after IVF. Ma'am, we cannot travel after IVF. No, it is not like that. You can travel after IVF. It is just that you have to avoid extra stress and strenuous activities, because when we put an embryo inside you, we want you to be at ease. We don't want that you should take the stress of traveling, or you should take the stress of lack of sleep. So we always tell you that take it easy for those 2 weeks when we put the embryo. So I want to tell you one thing. IVF is a beautiful journey. If you are a couple with infertility and IVF is the only option, please embrace your parenthood. Come to us, discuss with us, understand from us what is IVF about. Don't scare it. It is a very beautiful journey, and we are here to give you your ultimate joy. Thank you so much.